Welcome to the NICU Today podcast, a podcast to give families a new point of support as they navigate the NICU journey. Thank you for listening. Please don't forget to subscribe wherever you enjoy your podcast and share this episode with anyone who might find it helpful. Welcome back to the NICU Today podcast. Today, Jenné Johns is with us. She is a national health equity thought leader, author, and advocate for reducing healthcare disparities. While advocating for the needs of her own son, Jenné wrote Once Upon a Preemie, the first of its kind children's book written for parents of preemies while in the NICU. A graduate of the Disparities Leadership Program at Harvard University Medical School, Jenné has over a decade of experience advocating for policy and community changes to improve health equity and health outcomes for low-income communities. She also led quality improvement and health equity transformation strategies with the nation's largest health insurance companies. Jenné is president of Once Upon a Preemie Incorporated and founder of Once Upon a Preemie Academy, the first and only virtual training academy focused on delivering health and racial equity educational programs for perinatal and neonatal healthcare professionals. Welcome, Jenné. It's so good to see you.
Hi, Martha. Thank you so much for having me. Who's that person?
That's you, Jenné. That's you. Well, thanks so much for being here. We've known each other for a little while now and become friends. But I'm so excited for you to be here just to share more about your family story and about Once Upon a Preemie. But let's start with your family's own personal NICU experience.
Yes, Martha, I'm excited to be here today and to just be amongst a NICU giant as well, a NICU and preemie mama giant. So our family story goes like this. About 10 years ago, about 10 years ago, I was probably living my best life. I say that all the time just to put my pregnancy into context. Like before I learned I was expecting, I was moving and shaking in my career, traveling, had become a homeowner, and learned that I was pregnant and expecting my firstborn child. And I was excited, had all the prenatal visits, did all the things that the doctors told us we needed to do for a healthy pregnancy. And 26 weeks into my pregnancy, my water broke early and landed in the hospital. And unfortunately for us, my son was a footling breech. So he decided to turn himself around in my uterus, kick his foot through, and the doctors literally gave him 8 hours to decide on his own what he was going to do. If he was going to come on his own or if we needed to go in and do an emergency C-section to keep him and myself safe. So 8 hours after kicking his foot through my cervix, I went into an emergency C-section. And before you know it, I was a mom at 26 weeks. TJ came, 1 pound, 15.3 ounces. And we started our NICU journey from there.
And when you think back about your NICU journey, how did you advocate during that time? How did you get started? How did you face each day? Just tell us a little bit more about what you remember, which, it stays with us all the time, right? But how did you do that?
Well, I am a woman of faith, and so I needed to dig deep into my relationship with God and lots of morning prayers, lots of afternoon and evening prayers. However, I was surrounded by a village and a family that loved and supported me and my son and his father. And we got lots of calls. When the time was right, we had lots of visits in the NICU. But professionally, I was an advocate all along. I was doing the advocacy work for children across the nation around childhood obesity prevention and Medicaid expansion. And then it was my turn to turn all of that work that I had been doing as a professional advocate into being an advocate for my son bedside in the NICU. And it was a little different because I'm showing up as a mom, right? I'm not a healthcare professional first. I'm not an advocate first, I'm a mom first. And although my son was really tiny and he couldn't speak to me, we had our own bond and connection, right? So I knew when I showed up to the NICU, when things didn't look or feel or seem right to him, that I needed to learn how to speak up to the healthcare professionals or the healthcare team, to ask questions around or to get clarification around. And I'm going to be honest, Martha, sometimes showing up as a parent advocate um, isn't always accepted by healthcare professionals. Sometimes you're faced with that with some opposition or being ignored or being dismissed because they're the clinicians, you're just the parent. And it's like, well, wait a minute. I just want to be a part of the team here. I want to be a part of the team that's helping to keep my baby healthy, safe, so that he can come home alive with us one day. Because hopefully this won't be his final home. So, as a parent advocate, it took confidence and it took courage and it took speaking up and out often, to make sure that my mommy questions, no matter how nuanced, no matter how much I didn't speak the NICU jargon and language and speak for the healthcare professionals, was understood so that we could get on the same page around what I needed as my son's mom and as his biggest advocate and champion.
Now, you had that background with advocacy, but I do feel like something we talk about a lot is that parents don't know the questions to ask, right? They go in and they feel overwhelmed and they don't know how to advocate for their babies as much. And we actually, I'm so happy about this, but we just recently launched an advocacy checklist on our website where
Nice.
we worked with some social workers and nurses and childbirth educators. And we created this advocacy checklist that parents can download. We'll soon have copies in our NICU care packages, but trying to figure out what questions to ask because you do feel out of place. I mean, I don't want to say experts, but you do become more knowledgeable with that NICU language and what that information means. But when you go in, it's totally overwhelming, right? I mean, you don't know where to start or how you become a part of the medical team. But what you said is so important. As parents, you are a part of that medical team, and it's making sure that you know that and that you can advocate for yourself to be a part of that team.
I mean, the reality is for NICU and preemie families, the NICU becomes our home until our babies leave. And so I can remember being the first mom to enter the NICU as soon as the NICU doors opened in the morning. And I was typically the last mom to leave when it was discharge time for the parents. I didn't want to leave, but there was no overnight policy. So I had to go home. And so just by virtue of spending so much time in the NICU and bedside and seeing the clinical rotations and shifts and seeing the different specialists in and out, it's like, okay, I'm here, not necessarily notice me, but let's have a conversation about this baby and this isolate to help me better understand where he is medically, what things I need to do different as his parent. How can I show up to be a resource and support to you so you can best support my baby?
Yes, I love that. I love that.
And it's okay if you don't always have what's considered the right questions, because when it comes to your baby, guess what? There are no right or wrong questions. It's your question. It's your intuition. It's your gut. It's something that you're not sure or not clear about that you deserve answers around. And so, one of the things that I did to help me prepare my questions, if I had time to prepare them, because you don't always have time to prepare them.
No.
Sometimes you show up and your baby is perfectly fine, and then the next moment they're statting, and it's like, okay, wait a minute, what's happening here? So, on days that I had time to think clearly enough before entering the NICU or looking at his medical notes in the morning before visiting the NICU or calling the NICU at midnight or 2 a.m. or 3 a.m. because I couldn't sleep, if something didn't make sense, I'd make sure that I'd write those questions down to make sure I had them. And better prepared days, I would make sure I had 5 questions. And if I didn't feel like I got the answer that I understood or that I was looking for from the nurse who was responsible for my son's care that day, I take it to the neonatologist. I take
Yes,
it directly to the neonatologist. I had no problem climbing the ladder in the NICU to get what I needed for my son. And I would encourage other parents to do the same.
love that. Now, after your NICU experience, how many days were you in the NICU?
77 long, hard days.
You never forget the number, right?
Never forget the number.
No. After your NICU experience, you wrote a book. I have it here. You know I do, Jenné. I have it here.
I love it.
Uh, but can you talk to the listeners a little bit about what inspired you to write a book as a way to support other NICU families and how you even got started in that process?
Oh my goodness. I wasn't expecting you to pull up a copy of the book, but thank you so much for your support there. So, the genesis of the book. All right, guys, I spent so much time in the NICU. Like, the nurses were sick of looking at me. They were like, "Will you go eat lunch? Will you go pump? Don't you have to go to work today? Don't you need to start to get the baby room together?" So, one of the nurses who was amazing came bedside to me one day and said, "Jenné, you're here a lot. And um, why don't you bring some books in to read to TJ to help pass the time away? It's a great way to stimulate brain growth and development, and it's an excellent way to bond differently with your baby." And I'm like, "Oh, I didn't even think of that." She said, "You can read anything, even if it's not baby books. The literature that we give you, just start to read to them. It'll help you pass the time away. It'll help you bond." So, because I had a preemie, I didn't have a baby shower. I didn't have any baby books. I didn't have any lullabies at home, right? So I had to call on some family members and friends and ask for some donations of baby books. And man, did we get some donations. What started off as like 4 or 5 books became a whole library stacked up taller than his isolette in the NICU. So I was just reading to him constantly, day and night and day. He'd give me a little peek of his personality with certain books that we read. I remember loving the foot book. I was like, "Oh my gosh, this is so you."
Yes.
And I would always tell him the Dr. Seuss foot book. I was like, "Okay, this is you. And one day this foot is going to get you scholarship to go to college for free. Okay, just remember, that's our pact."
Yes.
He'll read the foot book, and he hated every minute of that book. I kangaroo care with him, and he'd squirm and move. And I'd pull out another book, and he'd be nice and relaxed. But when we were discharged from the NICU, I just remember journaling because we'd gone through a lot. It was a traumatic experience that we weren't expecting. And for the first time in nearly 3 months, I heard silence. I heard quiet because the NICU is a very loud place. And in the silence of bringing TJ home, I finally had a chance to process everything we just experienced, good, bad, and indifferent. And I journaled it as part of my own mental and emotional healing and help. And out of that journaling, I wrote a few poems and dedicated them to my son. And one of those poems, which at the time was called "You Are So Very Special," became the book Once Upon a Preemie. Our family knew that we wanted to give something back to the NICU to help support the other family members. And honestly, I was like, if we write a check, it's not going to make that much of a difference because it's not going to be that hefty of a check. We liked when families came back and gave us care packages and gifts on holidays like Valentine's Day and things like that. So I always knew when I left the NICU, I wanted to do something to give back, especially because I was a tough NICU mom. I was a very tough mom for the nurses to have to deal with. And it was almost like an apology to want to give and do something. But I don't know, we kind of put one step in front of the other after like reading this poem over and over and deciding we were going to do something with it. And then before you know it, the idea came that this is going to be like one of the NICU's first lullabies, because there were no lullabies that were written specifically for preterm infants or NICU admitted families. If you think about it, every children's book that's a lullaby is written for the full term infant in mind. Parents, read to the baby, kiss them, turn the lights off, close the door, and that's not everyone's reality. It's not everyone's reality. And so when Once Upon a Preemie was finally in book form and we started to make it available to hospitals and to NICU families across the country, the response was very positive. It was like, "Oh my goodness, finally someone understands our unique journey through this NICU."
Think when parents go through the traumatic experience of the NICU, many parents want to figure out how they can give back. What can they do? And everybody can give back in a way that works for them, right?
Right.
So you looked at the impact of those books and reading, which, by the way, is so important. And we talk about it a lot. It's one way of feeling a connection and feeling like you're doing something for your child in the NICU that feels, and I hate using the word normal, but just
That's right.
that's what it kind of feels like. Oh, I can read to my baby, right? Even if
Right.
they're in an isolette, I can open that door and read to my baby. But we've talked a lot about giving back doesn't look one certain way, right? We're going to get into what your nonprofit organization does, but looking at our family started taking Claire back when she was 18 months old so that we could meet with other families who had experienced the NICU and they could see a 23-weeker who was doing well. And we could talk to parents about loss. You wrote a book to be able to give back to families. So there's so many different ways that parents can look at giving back after their experience based upon what works for them, right?
And I love you for doing that, Martha, because I'm still not strong enough to go back into the NICU yet. It's still just a bit too traumatic for me. But having the holiday gifts and having the NICU graduates come back was a highlight of our NICU journey and experience. I absolutely loved seeing the kids who were once in these isolates and in this NICU walk through, just to see them walk through the door was like, okay, bud, we're doing this. You're getting out
Yes.
here one day.
Yeah, it's that I think it's that little piece of hope that it gives you. We
Yes.
talk about it all the time. It's just that little piece of hope. And that's what all of these stories do. I mean, they give parents hope. Now, where can listeners look for your book? Where can they order your book? Where can they learn more about your book?
Oh, thank you so much. So the book is on Amazon, and you can also purchase a copy on our website, www.onceuponapreemie.org/book
Love it.
/book.
Yes, love it. And we'll make sure we have that website in the notes as well. Now, your book really expanded into the idea for a nonprofit organization launching the first health and racial equity e-learning training program of its kind. Tell us about that program and what led you to focus your efforts on health and racial equity in healthcare through educational programs.
Thank you for that question, Martha. So, as we've alluded to earlier, I was kind of doing the advocacy and the insurance space work for a while, and all of the work that I've ever done in my career focused on, cultural competency, health and racial equity, different titles for it at different points in our country's history, but all stemming around equal care and equal rights and equal access. So once, becoming the book author for Once Upon a Preemie, I started to become the preemie parent advocate. And in the preemie parent advocacy work that I was doing, I never shied away from some of the racial issues, some of the culture and race-based issues that we faced in the NICU. Because that's all I was doing for my day job for a living, right? So I'm doing the health and racial equity work professionally, and then I had this lived experience personally. Where's the marriage between the two? And the health and racial equity in the NICU or for preemie parents that, Black preemie families or others may experience was the nice intersection, right? So for years, when I'm walking about the country doing the preemie parent advocacy, I'm overlaying everything with a race-based lens or with an equity-based lens. And 2020, when we decided to expand the work that we were doing as author, as preemie parent advocate and speaker, and turn that into the nonprofit Once Upon a Preemie, one of the first things that I knew we had to do was this cultural competency training for healthcare professionals. Why, Martha? Because you talk to one NICU family, you talk to them all. We all have some adverse experience that we faced in the NICU that could have been prevented or avoided with some type of sensitivity training. And then when you overlay that with race, ethnicity, and language, those differences and disparities are even more stark. So honestly, launching the Once Upon a Preemie Academy to do the health and racial equity accredited training for healthcare professionals was an extension of what I was already doing for a living, both as preemie parent advocate and also health equity executive. And when we launched, honestly, it was a pilot for us. It was just if we build this virtual training academy for healthcare professionals, will they take us up on our training offer? And so we offered our training courses back in 2020 online because we launched it during COVID. And we just wanted to reach 50 to 75 healthcare professionals. Across the series of trainings, we've reached over 900 from across the globe. And when we did our post-training evaluations, we asked the healthcare professionals, what additional topics or what additional content would you like Once Upon a Preemie Academy to make available to you? The overwhelming response was stay right here. We don't want to be the only keeper of this information. We want our hospital staff, we want our community facing work, we want, others within our institutions to come along this learning journey with us. So those were our humble beginnings for Once Upon a Preemie Academy and why we thought it was very important. And we've been seeing some really phenomenal results around the country leading that body of work.
Well, that's what I wanted to ask you about. And it is really focused on the NICU itself, which is what makes it so unique, right?
It is focused on the NICU. However, we do make the training courses available and the content applicable for any healthcare professional who touches the life of a Black birthing woman and a family who's been admitted to the NICU. Because we know the NICU is a microcosm of the larger hospital system.
Right.
And our NICU journey starts in labor and delivery.
Yes.
It
Yes, it
doesn't
definitely does.
always, like, we don't just land in the NICU. We have to birth first in L&D and then move over to the NICU. And even when you enter the NICU, you know this better than I, Martha, you can touch up to 20 specialties or specialists in the NICU to help keep, to help support your baby. So we want the community, we want the family of healthcare professionals hanging out with us in these training courses.
Well, and I'm so excited to share with our listeners that we're actually partnering with you with some of our hospital partners to be able to offer this training
Yes.
through our NICU Comprehensive Hospital Partnership in Montgomery County. So we're thrilled to be partnering with Jenné and Once Upon a Preemie. And I wanted you to have the opportunity to share what improvements have you seen, because you have been growing. Just so much. I see you growing so much, but what improvements have you seen since you've launched this training, or the feedback that you've heard from healthcare professionals?
We've had a mixed bag of results in terms of feedback. I'm not going to paint a beautiful picture with this conversation that everything is seen with rose-colored glasses, because it's not. Anytime you talk about differences in health outcomes, health status, or anytime you talk about race, ethnicity, disparities, equity, we will be faced with some opposition and some concerns, because at our core, no one shows up to work, no one shows up for life intentionally being biased, intentionally wanting to discriminate against anyone, right?
Mhm.
And we don't approach our training from that lens. We really just want to encourage people to identify some blind spots that they may not know are there, to help mitigate and eliminate or reduce any of those barriers, to have better communication, to get to the better outcomes for Black birthing women and preemie families. So with that, I'm going to share one example of what outcomes have looked like for those who have taken us up on our training offer. After launching the Once Upon a Preemie Academy in 2020, there's a NICU nurse manager in a NICU in a rural part of Texas, right? We're here in Philly, Pennsylvania, right? We're here in Philadelphia, we're in Pennsylvania. Because we launched nationally, we get a national audience, which is wonderful. But NICU nurse manager in a rural part of Texas saying, hey, what you did with the academy was eye-opening. I knew we had these issues in our NICU. We've been doing some work to address the disparities in our NICU, but it's not working. I want to see what happens if we can get all of our staff trained on this curriculum and to help improve our outcomes in the areas that they've struggled with for 4 years prior to hanging out with the academy. And so we worked together through a bit of a process, strategic process and training process. And this NICU in particular struggled with getting Black moms to initiate and continue breastfeeding for 4 years. So for 4 years, when they looked at their quality improvement measures and outcomes, this measure continued to lag behind for the Black and Brown population, met and exceeded national averages for every other population. So 30 days, just 30 days after completing the Once Upon a Preemie Academy, that disparity was completely eliminated and it was found to be statistically significant. So something that we communicated in terms of the realities of birthing while Black and birthing while Black in the NICU resonated and stuck with the staff enough that they looked internally and looked within their larger hospital environment to say, what barriers are we creating or have we put in place that's not allowing this mom to offer a life-saving strategy, right, for their baby? And so We were very excited to support that NICU through that very important quality improvement journey that, like I said, they struggled with for 4 years. So
Right.
30 days after completing 4 1-hour courses, this is no longer an issue. In some other NICUs, they may not have had a quality improvement measure that was already documented and stratified by race, ethnicity, and language to be able to say we want to close this quality improvement gap. So for those NICUs, more likely than not, they just want better patient provider relationships, better patient provider communication. And after completing our courses, the staff really understand what ways that they may have been previously communicating with or not communicating with that was not allowing them to reach that harmonious goal or even that respectful communication that is so very important and so timely, especially when for us preemie parents, I'm going to reiterate it, the NICU becomes our home until our babies are discharged. There's
Yeah.
no two ways around it. So we have to figure out how to coexist, and we have to learn how to be respectful, and we have to learn how to communicate so that we're all working from the same playbook with the same outcome and the same goal in mind. So those are a few examples of some of the outcomes that we've seen. Now, in terms of the feedback, I'm not going to shy away from this hard part. Some people just aren't ready to have the race-based conversation. Some people just aren't ready to have the hard conversation that not everything I do works well for every population that I serve, and that's okay. That's why we're here, not to place blame, not to minimize or downplay any good clinical practices that they're implementing, but be more humanistic, be more culturally sensitive, be more culturally appropriate where you can to help families feel like they're receiving high quality, equitable, family centered care. That's all we're doing this work for. I always leave healthcare professionals with this, and we do talk about this extensively in our training courses. Healthcare professionals may not always remember on a day-to-day basis that they have an opportunity to leave a NICU family with a bed of roses or a bed of thorns. And it would be better for all of us if we could all leave, feeling like we were supported, we were heard, we were respected, and our culture was at least acknowledged in the NICU so we can walk away feeling like we had roses during our experience, right?
Yes, thank you so much for sharing all of that. And also the feedback piece versus the outcome piece. That's incredible outcomes from the Texas hospital. I mean,
Yeah.
that's incredible.
I
We're
mean,
really
sitting here in Pennsylvania, we feel like if we can help support a NICU in Texas with these outcomes, we want to be able to replicate and do the same here in our home state of Pennsylvania. So we can't thank you enough, Martha, for making us a part of your team for the new grant program that you're rolling out in Montgomery County. Thank you.
And where can listeners learn more about your program and who takes these programs? Is it mainly healthcare professionals?
Yeah. So our audience for the Once Upon a Preemie Academy are your perinatal and neonatal healthcare workforce. So your doctors, your nurses, your respiratory therapists, your social workers, your respiratory. So pretty much any specialist and any healthcare provider that's delivering the care and touching the lives of these families. We also extend our trainings beyond the clinical setting. We've had partnerships with the National Healthy Start Association and some of the community health centers and some of the Healthy Start groups across different states to make the trainings available to community facing and home visitation staff as well. We are moving into a space where we're also going to start to train doulas because ultimately doula training is for the full term and healthy birth outcome, and that's not everyone's reality. So we want to equip them with the tools and the resources that they need to be able to support NICU admitted families as well.
And you host
Yeah,
an annual conference.
we do. We host an annual. You're making me remember all of our work.
I am. That's my job, Jenné.
When you're so busy doing the day to day, you kind of forget all the big, exciting things that happen. So each year we do host an in-person conference for healthcare professionals, parents, advocates, policy and decision makers, business leaders, payers, to come together for a full day of the academy in person, essentially. So we're looking at the Marthas of the world and the Jennés of the world who had the lived experiences and took action around their lived experiences to educate healthcare providers and professionals on what things parents need pre, during, and post NICU journey. And we're also pairing off with the healthcare professionals or providers who are doing the transformation work who are leading those clinical interventions and supporting the clinical encounters to offer their maybe not always evidence-based practices, because sometimes the best programs and services may never make it to the peer-reviewed literature to become evidence-based, but it is a practice-based solution that we bring forward to our Once Upon a Preemie community that travels to our conference each year. So we hope that some of your listeners will be interested in joining us. The conference will be November 18th this year, likely here in Philadelphia. And I forgot to answer your question about where people can find more information about the Academy. It's also on our website, www.onceuponapreemie.org/academy.
Great. And just a reminder for our listeners, we're here with Jenné Johns, president of Once Upon a Preemie. Now, I wanted to provide the opportunity for you because like I said, Jenné, I'm seeing you everywhere. Tell us some more about the other important work that you're doing.
Thank you, Martha. And we are right behind you. You guys are everywhere too. We also have a body of work to support policy changes at the state and hopefully influencing some of what happens at the congressional level. So for the last 2 years, we've been able to lead a Black Maternal Health Week campaign and then also lead some educational efforts during Prematurity Awareness Month, which we all know is November. So our policy and advocacy agenda looks like this. Anytime we have conversations about infant and maternal health, and in particular Black maternal health, we cannot forget the needs, the voices, and the lived experiences of NICU and preemie families. So we're doing the work to educate policy and decision makers on our needs specifically, to make sure that we are written into bills and legislation and that programs are funded to better support preemie families. We have a policy note in which lays out 7 or 8 policy recommendations to help support existing bills and legislation or to be written into law that include things like making sure that preemie parents have mental health resources and support. I didn't mention this earlier, Martha, but during our NICU journey, I had to make a tough decision when my son was in the NICU. I knew I needed some mental health help, but the resources that were offered to me were an hour away from the NICU. So I had to decide if in the middle of one of Philadelphia's worst snowstorm history, if I was going to travel an hour out and an hour back to get the mental health help, or if I was just going to continue to sit bedside with my baby. And what do you think I chose? Right?
It's that bedside.
Well, I chose bedside. So we don't want parents to have to make those tough decisions. Why can't we co-locate mental health resources in the NICU where families need it? The nation has a big national focus on getting doulas to support birthing women. And we absolutely unequivocally support and encourage the resources for families to be able to have doulas. Well, guess what? Who needs a doula more than anyone than a NICU family member? Someone to help us navigate the healthcare terrain while still hoping for and helping us to achieve the best health outcomes for our babies. So we, again, have those policy priorities that we advocate for year round. We raise a little bit more attention and visibility to the issues during Black Maternal Health Week and Prematurity Awareness Month. And we're also really thankful here in the state of Pennsylvania that we have a newly formed Black Maternal Health Caucus that we've been able to at least educate our peer organizations and stakeholders around the needs of preemie and NICU admitted families so that they too can become advocates for our needs as well.
Love it. I want to just step back to your NICU journey. What do you wish you knew when you look back at what you went through with TJ?
I wish I knew that discharge day didn't mean that, it did not mean that the advocacy journey stopped. It was just the beginning. We will always be our kids' biggest cheerleaders and advocates for medical things, for clinical things, for educational things, for social and emotional things. So whatever you put in place in the NICU continues with you in terms of your role as an advocate. And I wish I would have known that the things that I experienced in the NICU would stick with me for a lifetime as well. As I mentioned earlier in our conversation, we would love to be able to go back into the NICU and offer direct support for NICU families. emotionally and mentally, I'm still not there yet. And so just knowing that those things are triggering, and they're scars that we wish we could do away with, don't leave us, is something that I really wish I knew when I was in the NICU. And I wish I knew about a Today is a Good Day when I was in the NICU. There was no preemie parent support group when we were in the NICU. We had organizations who I mentioned earlier would donate items and care packages and gifts and things during special holidays and events. But how amazing would it have been, and how supportive would it have been to have us a Today is a Good Day by our side when we were in it, you know? So those are some of the things that we advocate for. These are very low hanging fruit, very low cost, no brainer things that every NICU should just come baked with, right?
Yes. Yeah, I know. It's that parent support. I mean, that's why we found it today is a good day, because we were missing that personal connection and we were trying to find it on our own. And so we wanted to create that opportunity to try and be able to give it to families who were going through the NICU and trying to make those connections and build that community for sure. Tell us how your son's doing today.
Oh, thank you for that question. He is doing amazing. He's 10 going on 30. He's running my life. He is doing great academically. He's a little comedian. He's all things boy, all things travel. And I couldn't have prayed for a better person to enter my life to be called my son. We're gearing up for spring break next week. I couldn't have imagined 10 years ago that we will be going on a cruise and we wouldn't, have to travel with a traveling nurse, or, not get medical clearance for him to be able to travel internationally. But he's doing phenomenal, and he's an avid reader. I like to think that it's our special time cuddling up, kangarooing in the NICU that helped plant that seed that helped him to just still have a love of reading.
I love that so much. Well, thank you for all that you shared today. We sincerely appreciate you being a guest on our NICU Today podcast. Thank you, Jenné.
Thank you for having me, Martha.
Thank you for tuning in to the NICU Today podcast, brought to you by Today is a Good Day. Learn more at todayisagoodday.org.